Hello and welcome. You're watching Frontline. Now, just weeks after the world marked the World Pneumonia Day, we still consider it as a forgotten epidemic. And before we get the statistics and actual content on pneumonia, let me briefly remind you the risk factors of this disease. Now, pneumonia is an infection of one or both of the lungs caused by bacteria, virus, or fungi. How do you tell you have pneumonia? You're likely to have a cough that produces green, yellow, or bloody mucus as the most common symptom of pneumonia. And now, under the COVID-19 pandemic, it gets worse. You can get pneumonia as a complication of viral infections such as COVID-19, the flu, or even a common cold. However, as much as pneumonia is not a death sentence, caution should still not be thrown to the winds. Did you know pneumonia is the leading cause of death in children under the age of 5 in Kenya? On the progress of treatment of pneumonia, several technologies have been rolled out to tackle the increasing cases of childhood pneumonia in the country, as Shilling explains.
Nearly 9,000 children under the age of 5 succumbed to pneumonia from 2018 to date, which, if I break it down to you, that's approximately one child every hour. The COVID-19 pandemic saw a decrease in the reported cases of pneumonia amongst children under the age of 5. However, these statistics of the situation in the country are nothing to smile about. The most affected counties in the country being Narok, Samburu, West Pokot, Marsabit and Mandera counties.
The Network on Child Health has scaled up strategies and interventions which improve child health outcomes, but we are not yet out of the woods. The statistics we are talking about still put us in the list of shame.
During World Pneumonia Day, the World Prematurity Day is also recognized as it contributes to more than 7,000 neonatal deaths globally every day, according to the Ministry of Health.
In order to ensure our preterm babies thrive and survive, the Ministry, through the Department of Family Health, has managed to scale up kangaroo mother care centers to 40 counties.
Crucial measures have been taken and technologies utilized to tackle this silent killer disease.
Sincerely thank our members of parliament for approving the breast milk regulations that were before parliament yesterday. Introduction of new childhood vaccines like pneumococcal and rotavirus vaccines, advocacy to ensure availability of essential medicines in facilities, and strengthening community interventions to ensure early health-seeking behavior.
It is prudent to remember that every breath counts and that no child should be left behind. Shilling Switch TV, Nairobi.
Thank you, Shilling. Now, to have this discussion further, we are joined by Lucy Muthoga, a senior nursing officer working in the pediatric department, who also doubles up as a child health focal person in Kajiado Central Sub-County. Thank you, Lucy, for creating time. How does pneumonia present itself?
Thank you so much for being here as we talk about pneumonia as a leading cause of deaths. And pneumonia presents with different signs and symptoms. The first sign is cough. Cough comes about, as we know, pneumonia is the infection of one or both of the lungs. So when the infection sets in to the alveoli, and in normal terms we call them the sacs, and the fluid is there, and after the fluid it creates infection, and that is why children cough to release that infection. So as we go ahead, we get cough. There could be difficulty in breathing. You see the child is breathing fast. We call it fast breathings. And in pneumonia there are cutoffs, whereby a child who is 0 to 2 months, the cutoff is 60 breaths or more. So if you get 60 and more, we term that as fast breathing. For children who are 2 months to 12, that's 1 year, and you count breaths per minute, and it's 50 or more, we say that child has fast breathing. Then we have the next category of under 5, where we have children of 1 year up to 59 months, actually, if they've not celebrated their first birthday, their 5th birthday. If the child has 40 breaths or more, we call it fast breathing. So fast breathing is one of the signs in pneumonia. You could have fatigue. Fatigue is just like tiredness. They look tired. Some have chest pain. Others they cannot feed. They are not able to breastfeed or feed. Others go to, when we take the SpO2, we call it oxygen saturation. They are less than 90. The saturations could be low. Those are just some of the signs. You could have grunting. Grunting is a sound that is brought when oxygen is low. So a child with pneumonia could also have grunting. So those are some of the few signs of pneumonia.
How about the causes?
The causes of pneumonia,
Yes.
the pneumonia can be caused by bacteria or virus or the fungi. That is how it's caused.
There are different types of pneumonia. Can you briefly describe to us those different types and their prognosis?
Okay, so there are types of pneumonia per se, but I'll focus on the very simple pneumonia, the way children present before they complicate, and it's classified also. So we can have pneumonia, we can have severe pneumonia or no pneumonia. Where we have pneumonia, the child has chest indrawing, and when you see the child has chest indrawing, this is where the child, when the child breathes in, the lower chest wall goes out. So you'll see there'll be fast breathing, and also there'll also be chest indrawing. The mother could complain of the child having a cough or difficult in breathing. So with just that one is just managed as an outpatient, where now we are giving amoxil DT and maybe paracetamol if the child is presenting with fever. So that is basically pneumonia. It's never admitted unless the child has other classifications or other diseases or other diagnoses, because a child can come in with pneumonia and other diagnoses. Then we have severe pneumonia, the severity, and in severe pneumonia, the child could be lethargic or unconscious. The child could either feed or not feed. The child could have grunting. There's something we call cyanosis, and cyanosis is the blue coloration of the mucous membrane just under the tongue. So that is cyanosis. The child could have very difficulty in breathing. We call it acidotic breathing. So that is severe pneumonia. And as the name suggests, severe pneumonia is normally admitted. If they are in the peripheral facilities, they need to refer the child. And when the child is admitted, then the child is given antibiotics to clear the infection and maybe oxygen so that breathing can be enhanced. So that's severe pneumonia. Then there's another one that's called no pneumonia. It's just cough or cold. So the child could just cough, but there are no signs of pneumonia. So we call it no pneumonia. It could be either cough or cold.
Which one is easily treatable among them?
Among them, of course, no pneumonia, cough or cold,
Yes.
it's easily treatable. Pneumonia also is easily treatable. But for severe pneumonia, being an admission, then it takes some days because the child has to complete the course of antibiotics. Yes.
Lucy,
So they are all treatable.
they're
I
all
say.
treatable.
Yes.
Do these pneumonias, when they occur in children, do they have a knockdown effect later on in the child's life?
Yes, there are complications of pneumonia, and one of the complications is something we call pleural effusion. This is where fluid is accumulated in the lungs, or we can have empyema, where pus is also accumulated in the lungs. We can have sepsis, we can have lung abscess, so there are some complications that come up with pneumonia, with severe pneumonia.
Into teenage or adulthood?
No, I'm just talking about under 5.
Under 5.
Under 5, if interventions are not well taken in time. But if interventions are taken well in time, then severe pneumonia clears off.
In the case of, Shilanga teacher's story, she told us that one child dies every hour.
Yes.
At what point do we get that tipping point?
This is where maybe health services are not well. The caretaker has not gone for services on time, and maybe this could be due to infrastructure of where the caregiver is coming from, or just ignorance. Yes.
We have also seen that in these arid and semi-arid areas, pneumonia is more prevalent. Why is this the case?
Okay, there are other risk factors that contribute to pneumonia, like we say, if the child is not well breastfed. As we know, for any child who is born, the child should be breastfed 6 months, at least for 6 months exclusive.
Yes.
So that's a risk factor already. And then for these areas that you're talking about, there could be overcrowding, and especially where they stay in their setups. There could be overcrowding, which is also a risk factor. Another risk factor is if there is somebody maybe who could be smoking in the house and the children are there, is overcrowding. That also could be a risk factor to pneumonia.
Let's take a short commercial break. Lucy will be right back. Stay tuned.
This is a really important question, and we continue to learn about SARS-CoV-2 virus, the virus that causes COVID-19. There are different types of disease presentation based on the age of the person who is infected by this virus. Luckily, children and adolescents tend to have more mild disease compared to adults. In some individuals, they may have gastrointestinal symptoms. Others may lose the sense of smell or the sense of taste. Especially in the youngest children, they tend to be more mild, which means they don't have as many symptoms as adults do. Some children may have gastrointestinal symptoms like diarrhea or vomiting, but they tend to be more mild. And even most children tend to have asymptomatic infection, which means they don't have any symptoms at all.
Welcome back. This is Frontline. We give a special focus to pneumonia, especially in children. Lucy, with the conversation, maybe we can continue. What's the situation on the ground currently in relation to pneumonia in children?
Yes, pneumonia is still leading. It's still high. It is still on the ground. If you go to most of our outpatients, they normally see pneumonia, and also in our inpatient department. So at least every day we encounter a pneumonia case, either pneumonia or severe pneumonia. And there are also other types of pneumonia that we may not be able to discuss here, like there's aspirational pneumonia, lobar pneumonia, bronchial pneumonia. All those are pneumonias, but we decided to classify the very simple pneumonia.
Now, how many cases of pneumonia do you encounter in a day from your office?
Okay, from my department, we encounter in a day 2 to 3 admissions of pneumonia or severe pneumonia. This is because it could be brought by the risk factors that we talked earlier, because in that area the malnutrition is also high, and if a child is malnourished, then the immune system is low. and this child could easily get pneumonia rather than a child who is not malnourished. So we get 2 to 3 cases of pneumonia or severe pneumonia.
Lucy, how should then a mother, caregiver, guardian, what should they do to ensure they protect their child from pneumonia?
Thank you so much. A good question. First of all, the mother should ensure the child is fully immunized according to the KEPI schedule, the Kenya Expanded Program on Immunization. So this child should be fully immunized as per the age, because in immunization we have a pneumococcal vaccine. And if children are immunized against the pneumonia through pneumococcal vaccine, we still believe it can go down. Then, as a guardian, you should also give your child a lot of fluids to prevent dehydration. Monitor fever for this child, because most of the pneumonia cases, they also present with fever. So it's also good to monitor fever, and I would also urge the guardian or the parents to avoid over-the-counter drugs which are not prescribed. Because sometimes they see the child is coughing or has difficulty in breathing, rushes over the counter, and the drug has not been prescribed by either the pediatrician. So the child can resist the drug, which could bring complication. So as a guardian, please don't buy the drugs over the counter. It's also good to avoid overcrowding, because remember, it can also spread through droplets from an infected person. And I can say after COVID, when people are putting on masks, I think it has dropped kidogo. Yeah, then the mother also, or the guardian, should also put the child where there's no smoke, and especially the cigarette smoke. If there's a smoker in the house, at least to avoid smoking in the house. So these are some of the things. Washing hands is a very key area. As we know, children can touch anything, eat anything. So it's good to wash the hands of the child. And then if the child is bigger, if the child is older, it's also good to show the child the etiquette of coughing, sneezing, and such kind of stuff.
We see children taken to daycares. Can they contract pneumonia from those daycares, and what should be done?
From daycares, maybe what we can just emphasize, it's just overcrowding. Overcrowding is the thing, but we can't say from daycare they can get pneumonia. We can't say like that. But what we are supposed to do is to just advise the caregivers to avoid overcrowding.
The vaccine.
Yes.
It's here, and
yes.
It's helping. Is it compulsory?
Yeah, the pneumococcal vaccine, it's among the vaccines that are given in our maternal child health care clinics.
Also, Lucy, there's a program that you're running. Can you tell us about it and the organizations that you're running?
Okay, in the county, there are partners who have also journeyed with the county, and we have Clinton Health Initiative.
What's that?
We call it CHAI, but in full name, it's called Clinton Health Access Initiative. So when they came to the county, and in partnership with the county, they did a baseline survey, and there were a few gaps that were seen on management of children under 5. So there were guidelines that were brought up both by the ministry and the partner about integrated management of newborn and childhood illnesses. It's called IMNCI. Basically, it gives the health workers guidelines on how to manage pneumonia at a lower level.
How many people have you reached so far?
What they did, they supported in trainings, and also they've supported in mentorship. So after training, now staffs would be able to pick up pneumonia and do nice classifications on the same and give the best treatment so far. So it was also connected with another program that they also supported the county with, and it's emergency triage, admission and treatment. We call it ETAT, whereby children are triaged at the outpatient, then the health worker can know who is to come first and who is to follow and who is to be given priority. So through those emergencies, the healthcare workers have been able now to pick up the emergencies and manage them promptly and do resuscitations.
Wow, thank you. That's where we wrap up the show. Thank you so much, Lucy Muthoga, the Child Health Focal Person in Kajiado County, for creating time. We'll leave you with this clip on how to manage emotional and behavioral disorders in children. My name is Lincoln Mbogo. Till next week, same time, stay safe.
When it comes to the emotional and behavioral, that's how the children behave, maybe how they react. We have a number of areas that we can say that we can look at. We have the ODD, which we say is the operational deviant disorder. We have even the conduct disorder, and that's how they are categorized. In both, it's all about being deviant, having a deviant behavior, or whereby a child does not want to obey the authority or the authority figure. And we may say that the causes are genetics and we can say biological, because there are children maybe who can have the brain damage, and in this case you may see them behaving in a certain way. And in this we may see, like in conduct behavior, children might have experienced very tough situations or experiences as they were growing up, maybe being abused when they are children, maybe the neglect from even the parents. This may cause the child, having that behavior, I want to harm the person. If you can look at even to our the way the situation is in our nation, where we have even children burning schools, we need to ask ourselves, do they have conduct behavior, whereby because they feel satisfied when they burn the school, that is awesome. They feel satisfied when they are doing harm to you, and also they feel that I'm okay even when I'm bullying somebody else. So most of them, even they don't want to be told. And if it comes to the ODD, they are aggressive. They don't want to be told anything. They seem that, even they can argue with you. Even when you're trying to tell them this is not good or this is good, they may try to say, I know what I am doing. And this can be noticed by the age of 6 to 8 there. You can realize that this is not normal. There are times some of these behaviors, they are kind of, we can say they are normal. But when they take a longer time, you see that they are distributed for more than even 2 years. You need to ask yourself, what is happening in these children? So it's good even to have some diagnosis from the doctor. And also the family therapy is very, very important, where the family can come together and they be helped on how to handle this child or to handle a teenager. And also a teenager may even be advised or called upon to seek for therapy.